house. I just wonder if things are settling down for you. Just how's things going for you?
Yeah, it's settled down a lot. I forget who it was. Somebody who knows more about media than me kind of said the less in-depth the reporting, the less the attention span tends to be. So that prediction kind of came true. The media things has settled down, and I gave my first interview on Thursday to Matt LeBlanc of Norfolk today, and it went really well. He was super fair. I believe it was all posted this morning. So I think the 24-hour news cycle has moved on, and I've moved on with doing the actual work and paying a little bit less attention to the airwaves. So so far so good.
Thank you.
Okay, and if there isn't anything further there, first I'd actually just like to call for an acceptance of the introduction. I'm sure we need that, Kristen.
Yes, please. Thank you.
Councillor Huffman, looking for a seconder. Councillor Van Passen, all those in favor? And that's carried. Thank you. And Matt, if you'd like to begin.
Great. Thank you, Mr. Chairman. Thank you, everyone, for having me here today. For those of you that don't know me, I'm Matt Bowen. I'm the Chief Executive Officer with the Haldeman Norfolk Housing Corporation. And I'm here today in my deputation following my presentation as a staff report on AAMRs, or Alternative Average Market Rents. So I know I have 5 minutes. I'm going to try to get through this as quickly as I can, but it is pretty important information here. With that said, I really like to go over some quick definitions, talk about how AMR affects the community and the development of affordable housing. I know Heidi talked a little bit about the rent matrix, so I'm going to sort of glaze over that, but I also want to talk a little bit about the benefits of AAMR, and then the Housing Corporation's recommendation, which is a little different than what the staff recommendation is here today. So what is MMR? The median market rent is the result of the Canadian Mortgage Housing Corporation's annual rental market survey. And this survey represents the median of all rents currently being paid. And this universe will range from long-tenanted households to rent-controlled units and newly constructed markets. And I just want to add that in Haldeman and Norfolk, there's only one MMR. So rent in Simcoe is the same as Caledonia, and Caledonia is the same as Delhi, and Delhi is the same as Dunnville. So that there presents a challenge in itself. So what is the AAMR? The AAMR is an alternate average market rent, and the Ministry of Municipal Affairs and Housing allows for the service manager to submit a local market rent survey and business case to be considered in approving AAMRs. And particularly, CMHC will alternatively rely on these approved AAMRs instead of MMRs in funding applications. And this is really critical for not only the Haldeman Norfolk Housing, develop affordable housing. So how does AAMRs affect the community? I want to be very clear with everybody that changing AAMRs does not affect the current service level standards offered within the counties. It does not. Establishing an AAMR for the service area has no effects on households living in RGI. So I just want to be really clear with that, so that there isn't, the idea that we're going to eliminate or reduce the number of RGIs as a result of this. We're actually going to net new additional affordable housing in addition to the service level standards that currently exist in the community. Households on the wait list are eligible to live in RGI units. So if they're placed in RGI units, their rents do not increase. So with the approval of an AAMR for a service area, they'll have greater opportunity for more affordable housing. Because what we want to happen is for folks to move through the wait list and not just live in rent geared income housing. But without the change in AMRs, or without having the additional affordable housing, there's only rent geared to income housing. So although our AMIs are a little bit higher than what we would necessarily like, it still provides an opportunity for additional affordable housing in the market, not just maximum market rents, which we're seeing at right now at a very, very high number. So who does this affect in the housing continuum? The housing continuum affects more than just folks on government pensions, Ontario Works, and ODSP. What we're looking for in the development of affordable housing, again, is to maintain the rent geared income housing, but open a door to affordable housing. Again, we're looking to house people who work at Toyo Tetsu, not necessarily just minimum wage, but the potential for minimum wage, and couples, not just a single senior or a single individual on ODSP or Ontario Works. So how does it affect the community? Households who pay more than 30% of their pre-tax income have a greater opportunity to find affordable units with an AMR, and I just talked about that a little bit. What we're doing is providing an additional opportunity outside of the traditional rent geared income. So households facing deep affordability issues, recently there's the county's funded the Dogwood Suites project. You have Hamilton Hall. So there have been municipal contributions put towards the development of supportive housing, which is good, and it's very much needed. Folks with mental health and addiction issues do struggle to find housing. But I do want to really just pause and make the committee that there are other folks struggling to find affordable housing as well, and that's in addition to those folks who we support. Are really looking to find an opportunity for other folks as well. It also provides community partners an opportunity for housing as well. A lot of smaller housing providers and organizations can't just go out and develop affordable housing. So by HNHC providing potentially partnerships within an affordable housing program, that then reduces costs to organizations. It helps streamline and coordinate resources and provides a benefit to the smaller organizations as well. And I also want to stress that, again, this impacts the ability for private developers to come in and develop affordable housing. Based on the current market rents, I'm not aware of a developer that can come in and build affordable housing based on a rental pro forma financial plan of $680 to $700 a month for a one bedroom. So we have these guidelines in place, but they're not realistic. Nobody can find an apartment in Caledonia or Simcoe for $700 and can't develop apartments.
You are approaching your 5 minutes, but I'm happy to give you a few more. Don't worry.
Yeah, I'm sorry. This was, this is something that we're passionate about here, and it will make or break a lot of financial plans for the development of affordable housing. So I appreciate that. So the service manager, with the approval of the AMRs that HNHC commissioned the study on behalf of the service manager. We paid for that study to help support the entire service area. Again, this doesn't benefit HNHC. But with the approval of the AMRs, we will be able to, and other developers will to obtain federal and provincial funding, a greater range of funds, and foster an environment that allows community housing organizations and developers to work together. The Ireland Hub Street property is a great example of private development working with public agencies, and we're excited about that, and we're looking at housing a whole bunch of different people. Again, we've talked about partnerships with Fanshawe College, so student housing. So when we look at the report, I know I'm winding up my time here, but in the report that staff had provided, there were two scenarios, and I just want to draw your attention to those in the next meeting when you're having those reports. Those two scenarios are based on just a single senior on a government pension and a single individual on minimum wage. And our argument is that we are aiming, to touch on other people. So perhaps I'd be happy to provide some financial modeling where we're looking at two incomes, or a minimum wage earner, or seniors who are couples who have downsized, two students who are living together as roommates. I just think there's an opportunity to provide more data to the committee around what potential households could look like. And I do want to stress that we're not just targeting single individuals at the very low end of the housing continuum spectrum. So with that, I just do want to wrap up with saying the current rents right now, based on the CMHC guidelines, are not realistic. And in our humble opinion, and that of our consultants and others, local housing corporations across the province, we have to shift and adapt to meet sort of what those numbers and rents look like. And I'm certainly not saying that, we want rents to be unaffordable, but in their current state, we're not doing either county any favor by maintaining those and acknowledging those rents when nobody in the community can physically actually go out and get those rents. So I'd like to leave you with that thought, and thank you for the opportunity. Our recommendation, our board of directors and myself, is that that the committee not receive the information as report, but that you actually accept the study that was completed and direct the service manager in some capacity to work with the Ministry of Municipal Affairs and Housing so that we can fix those numbers, and really do something about the challenge that we have in front of us today here in these counties.
All right, thank you, Matt. Are there any questions for the presenter? Councillor Van Passen?
Yes, thank you, Mr. Chairman. Not sure if this question should be now or when the staff present the report, but since we got access to all the experts right now, we might as well make use of it. It's been a few years since I did my economics class in high school, but it seems to me that the rent is a matter of supply and demand. And when the demand far outstrips the supply, and how is it that changing the system, how does that help developers build housing that is more attainable to those beyond the ones that are on government assistance? Because, that's my goal, is to not subsidize people. How do we find that way to have the private sector supply that without the need for the subsidies and break that whole cycle? So I don't know if Matt can answer that, or maybe Heidi can jump in. So
I would, through you, Mr. Chairman, I'd like to take a crack at that first, because that's exactly what we're trying to do here. In our regeneration study, in all of our planning documents, all of our plans point towards mixed income community development builds that are either a part of a complete community that include, partnership like Calibrex on the hub lands to have more than just 100% rent geared to income housing. And how that happens is, through the development of housing in this model, where we have multiple rent revenue streams that make the building 100% sustainable. In our regeneration plan, by us, fostering rents from market rent folks, from affordable housing tenants and RGI tenants, that makes the building sustainable, so that you don't have to subsidize it on the capital side down the road. There is initial investment from the municipality in terms of the capital cost, but the multi-streamed revenues from mixed income housing provides that opportunity for sustainability. By updating the AAMRs, it's actually going to entice private developers to come in because they can make money. They're not going to build housing just because it feels good. They want to build housing because they're going to make money and they're going to feel good. And that's what we saw potentially on the Ireland property, is because that potential is there to do good for the community, but the potential there is also to make money. So, as a staffer on my end, that's what we are trying to do, is to work with private development firms and put together the best case scenarios, maximizing, federal and provincial funding. And the way you do that is the way that we've, modeled out these financial plans.
Thank you. And Heidi?
Thank you, Mr. Chair, through you to Councillor Van Passen and committee members. Affordable housing, generally speaking, requires some level of government subsidy from some level of government, either on the capital side or on the operating side, for the very reason that tenants don't pay enough money to fully sustain the building. And we have built, since affordable housing programs came into effect in 2007, we have built with private developers over 100 units of affordable housing across the two counties. And those have been with capital funds from the federal and provincial government. Those federal funds continue to be available. I want to be clear, and I don't want to get too far into this before I present the report, but just to be very clear that I do not envision the buildings that are proposed in the regeneration study as 100% rent geared to income. That's not what I'm suggesting. That's not what I'm advocating for. I understand the benefits and the importance of mixed income communities. And Matt and I have talked about that. And I have indicated from the very first day that I met Matt that I support mixed income communities. This is about the levels that we set, the maximum levels that we think are attainable for people in that affordable level. And the purpose of this report is to present, as you know, I'm not providing every scenario possible, but just providing a couple of scenarios to see that we need to be careful not to further push community out of the housing market. That's the concern. And respectfully, I would not be doing my job if I did not bring that to your attention as a potential unintended outcome. I don't disagree with anything Mr. Bowen has said regarding the value of mixed income communities, the value of providing housing to folks who, other than those who are on rent geared to income assistance, the fact that it would make it easier to develop affordable housing. I don't disagree with any of that, and you will see that in the staff report. My caution is around the potential to create further housing affordability pressures for those community members who are at the lower income spectrum in our community and who are already finding it difficult in this housing market. So to answer your question, Councillor Van Passen, when affordable housing is constructed, there is subsidy on either the capital side or the operating side or both in order to make up that gap between what the tenants pay and what the market could bear.
And if I can just add that quickly, that our plans are looking at capital on the front end. Our building through our rent streams are sustainable for long-term capital.
Any further questions? Councillor Van Passen?
Yes, thank you, Mr. Chairman. Yeah, and that's what I'd like a bit more information on, as well. We'll deal with it more so, I think, with the report. But there is a big difference between one-time capital investment and ongoing monthly expense. And where is that balance? And how do you not push out that very most vulnerable segment, but still allow the builds? And, you know, I look back to last year. You know, that's one of the reasons that council looked at our official plan and zoning bylaw with the adjustments to the accessory dwelling. That, you know, if we can make that process easier, it should free up either rental accommodations or, you know, the option of moving aging parents close to a family member, but that will free up the parent's house to be rented or to be sold. You know, there's all sorts of different ways just to create that or alleviate that problem of a lack of rental accommodation. And, you know, when we get to the part of discussing the report, I'd like to make sure that we don't just receive it as information, that we need to carry it further, get some more detail on it, and get a bit more on what that balance point is. Because, you know, Heidi, you can correct me if I'm wrong, but I think between Hallam and Norfolk, we spend about $6 million on the housing situation. And, you know, I'd rather spend more of it on capital to solve the long term rather than every year using it to directly subsidize rents. So, you know, again, I'm treading a little bit on both sides of the line for deal with the report and a deputation, but I think it's all good answers to get right now. So.
Heidi?
Thank you, Mr. Chair, through you to Councillor Van Passen. I think that to answer part of your question, and the report talks about the differences between rent geared to income, affordable, and market rent. The legacy rent geared to income units that we have, 826 of them, that were transferred to us from the province in 2001. Those are the units that receive an operating subsidy every year from the municipality. That is mandated by the province. So in the Housing Services Act, we are provided with a formula to calculate the operating subsidy for our private nonprofits. We make those calculations. There are some federal funds that go towards the cost of the mortgages, but there is a mandated operating subsidy for each of those, and it's charged to each municipality based on the location of the units. If those units come out of the program, either because the provider has paid off their mortgage and they're no longer tied to us in an agreement, or we decide to give service manager consent to sell some of those units, we need to replace them somewhere else in the system. And the province indicates that the municipality needs to continue to provide a stable level of funding. And there are options as to how we can do that. It doesn't have to be legacy rent geared to income in an apartment building. It could be housing allowances. It could be a few units within a mixed income community, which is what the Housing Corporation is proposing. But those RGI units need to have an operating subsidy attached to them according to the provincial legislation. The units that we build over and above that in the affordable housing category, that's where in order to make the project viable from a capital perspective and from an operating perspective, that's where they're in the time that I've been here, almost 9 years working with developers, every single new affordable housing development that has been built here has had capital support from the federal government and or the province and or a municipality. I think about the Aspen Apartments building that is in Dunnville that Haldimand County contributed land and $250,000 towards. We've had, you know, Norfolk, there was a commitment to Dogwood Suites, and we've been able to access additional provincial funding to get that commitment down over the years. But for sure, a private developer, if they aren't able to charge the level of rent that is at the market level, there has to be some sort of contribution to make up that gap. And, you know, I guess my concern, as I've indicated in the report, is that with the housing market, the way that it is right now, to use the rents that are at the current market level to calculate the 80% affordable level, I am concerned about who that's going to be truly affordable for. I acknowledge that what Mr. Bowen is saying about couples, about people who make more of a living wage, that's included in the report as well, that those rents may be affordable for them. But for those folks who are already challenged, that we try to offer affordable housing as an alternative to RGI, not a replacement, but an alternative, that's where these alternate average market rents are leaving me concerned. And as I said, I would not be doing my job if I did not share that with you.
Thank you. Any further questions, or I'm looking for a mover to accept the presentation before moving on to the report? Councillor Corbett, a question or moving the receiving the presentation?
A mover of the report.
Perfect. Looking for a seconder for the presentation. Councillor Huffman, all those in favor? Okay, and now if we're moving on to the report, just wondering who's going to be presenting that. If you could cue it up.
Thank you, Mr. Chair. That is myself. So as we've been talking about, this report is in response to the survey that was completed requesting an alternate average market rent. This request came forward from the Housing Corporation through their regeneration and strategic asset management planning process. And so I indicated to them that they could commission that report as part of the process in order to bring this forward. On page 2 or the first and second page of the report, you will see the definitions, the differences between rent geared to income, affordable housing, and market rent, which we've been talking about. And for the purposes of this report, we are only talking about affordable housing and the rent levels for affordable housing. So each year, our department receives a communication from the ministry with the market rent levels per unit size as determined by CMHC, and the 80% average market rent levels that we use as our affordable rents. And those are provided to all of our affordable housing developers every year. They do they do increase modestly year over year based on provincial legislation, and the rents for 2021 are included in the chart on page 2 of the staff report. So on page 3 of the staff report, you will see a chart that shows the comparison between the alternate average market rents that are being requested. I calculated the 80% of the alternate average market rent, which would become our new affordable level rents. So that's the middle column in the chart on page 3 of the report. And then the final column of the chart shows you the difference between what we currently have and what we would have if we accepted the alternate average market rents. I have acknowledged that, and I do acknowledge that the rent levels that we get from CMHC are lower than what is going on in the market. And as I stated, I think that because of the way the housing market is going, that I would have concerns if we were to use those rent levels in order to calculate the 80% affordable rent level. Because of my questions and my concerns about the true affordability for some of our more vulnerable community members. It is important to note that these alternate average market rents would become the new, and the 80% would be the new affordable average market rents for our entire service manager area for every affordable housing developer, not just for the developments that are being proposed by the Haldimand Norfolk Housing Corporation. Matt and I have had a number of conversations about this, and I have raised my concerns with him that I have raised in the report. I have done 2 scenarios for you based on a couple of different things. One, conversations that Matt and I have had about who might live in these buildings, and secondly, based on some of the communities of people that I think are challenged with housing affordability right now. So the first is a single senior whose income is old age security, and you can see that I've calculated some things out for a 1-bedroom apartment, building in some assumptions, like medication, like that someone could live on $50 a week for groceries, and that they don't have a car. And you can see that that would be, they would have $53 left at the end of the month and would be paying 73% of their monthly income on basic shelter costs, which we consider to be rent and basic utilities, not telephone and TV. The scenario 2 is a full-time 40-hour-a-week minimum wage worker living in a 1-bedroom apartment. So I've calculated their gross monthly income. Again, I'm not an HR payroll professional, so I calculated 15% of their mandatory deductions. I think that that would probably cover their income tax, but it may not cover all of the deductions that would be coming off their check. I did put in an allowance for this individual for some sort of transportation to and from work. And again, no clothing allowance, nothing here for car repairs or unanticipated expenditures, and nothing for medications. This person would have just short of $300 a month, which perhaps we think is adequate, but I think it leaves them pretty close to the edge of having some challenges should their hours get cut. Like I said, should they have a car repair? Should they need medications? Or should something unexpected happen? We also look at the fact that 50% of their gross monthly income and 59% of their take-home pay is being used for basic shelter costs. And according to generally accepted housing affordability standards, anything over 50% is considered not affordable. Just noting that if this was a single individual living in a 1-bedroom apartment with a child, that those expenses would be even more out of whack because I didn't calculate any expenses for any additional family members. I did not calculate scenarios for individual on social assistance, either Ontario Works or ODSP, because the basic rent levels start at over and above what they can afford. And as the report notes, absolutely, I acknowledge that the proposed rent levels may be affordable for couples who have more than one pension or more than one source of income, and individuals who are making more of a living wage, which has previously been calculated for Haldeman Norfolk in the $17 to $18 an hour range. And we know that there are jobs in our communities that pay that much. We also know that there are a number of workers who are earning that minimum wage level. So I think before council makes a decision to go forward with these alternate average market rent levels, I think we just need to consider what those unintended consequences might be, and the fact that if council is intending that our social housing wait list will go down because of new affordable housing development, that may or may not happen based on the alternate average market rent levels that are being proposed. And so at this point in time, respectfully, this report is being presented for your information. Because of the concerns that I have, respectfully, I'm not in a position where I can recommend support. I would, however, be willing, if council wanted to defer this report, to go back and do some further research about what, some sort of meet in the middle might look like. And with that, Mr. Chair, I'd be happy to answer questions.
Thank you, Heidi. And I had Councillor Corbett first, followed by Councillor Huffman.
Thank you very much. I'm going to enter my comments, and there's probably some questions along the way as well. We have 0% vacancy rate in Haldeman County. We done the regeneration study because we felt we were putting good money out for bad money. And I can tell you as a taxpayer, I'd rather pay towards assisting somebody with their rent than pay the maintenance on a cost. If we're allowing somebody to live in a single, in a house and pay $138 a month for rent, when you know the taxes on that would be $200, plus you're dealing with older buildings built in 1954, it's just not sustainable. Haldeman County has come up with a strategy that they want to go forward with. It's looking at a $15 million investment, of which the county would pay $5 million to get involved with, and it's contingent on these rental rates. And that concerns me as well. I know through an article in The Spectator recently put out and commented on that the alternate rate in Hamilton for a single, at least a one-bedroom unit, is $1,033. Ours is $607. If you were a prudent person looking for housing, where would you would go to the less, where a lesser rent is. I know the province is not keeping up with the housing rates that they provide for these people on social services. It's not fair that they burden the community with these types of rates. We want to get into a sustainable type unit. Might cost on one side, but it's helpful on the other side that we get these new units and provide housing for other people in other circumstances that could benefit by it. It's a win-win situation for them. I look at Del Gold Villa in Delhi, where it's self-sustainable. The Haldeman Norfolk housing unit or corporation just took that on, and they brought into the corporation some additional funding. You talk about the units that we have, in Dunville. It seems that we have all the units, and I know my fellow partners out in Jarvis area and that area are looking for some type of housing. And every year, the province comes out for some funding for that type of thing. We got to look at going on that. We have in Dunville nonprofit, that is 60 townhouses, 3 bedrooms. So we are addressing a need in that area, and it's not under our umbrella yet. But I can bet in the near future you will see that coming under our umbrella. So I'm looking at providing something that is sustainable for our municipality. We're looking at that investment. It's proposed that we're going to have a 1% tax increase to look after it, contingent upon looking at this study, and to dismiss it and say we don't want to look at it is not acceptable to me. We have to go out, we have to check it. I like the idea. Well, first of all, I'd like to see us adopt it, but I'm a reasonable person, and to look at it at a reasonable time to see where we actually are at. Because I've seen the rental increase on the market increase from 800 to 1,400, and how they do that, they kick the people out saying they're going to do some adjustments on their rental unit, and all of a sudden you're looking at this and they get away with it. $800 to $1,400, that's quite an adjustment. That's what these people are looking at. If we can get into what we want is multi-unit residential unit that we're looking at in Dunville. We provide the land and waive the fees. It's going to assist. Again, would you rather pay for repairs on an old car or get a new car? That's the opportunity. And I tell you, for us to go forward with that $15 million project, which will guarantee that we maintain our RGIs and do something to help maintain a level or sustenance for those properties. So to do nothing again, repeating myself, is not acceptable. The least I would accept that we would go out in a timely fashion. This has been going on too long. Make a decision one way or other.
So if I may, we are in question period, Councillor Corbett. I haven't heard a question yet, so wrap it up here.
Well, the question is, and I told you to begin with what I was going to do, wrap it all in one. If we let this opportunity go by, what is our opportunity to have housing?
Thank you. And Heidi, if I can have a response.
Yeah, so thank you, Mr. Chair. Through you to Councillor Corbett. First of all, I think what both counties have been doing to support affordable housing is amazing. And I have great appreciation for that. And I absolutely want to see both of those developments move forward. If the alternatives are not supported, it would mean that the Housing Corporation would need to increase the amount of capital that they need in order to build those buildings. And that could be from the National Co-Investment Fund. It could be, they would have to go back and look at the budget in order to increase the funding on the capital side. I recognize that Haldimand County has hit a max on that and put a cap on it to say this is how much you're getting and that's it. And the report acknowledges that, and I acknowledge that their budgets for those developments include the alternate average market rent. And again, it is my job to provide you with all of the information that you need to make an informed decision. See areas where there could be unintended outcomes. I would not be doing my job if I didn't present those to you. Those outcomes may not happen, but I think they might. And so it is my responsibility to share that with you so that you can make an informed decision and weigh out the risks and benefits to it.
Thank you, Heidi, and I'll allow Matt to respond as well.
Thank you, Mr. Chairman. I just wanted to reiterate with the committee here that our funding modeling is based on those AAMRs and the provincial and federal funding. So to say we could go back to the province or the federal government through the co-investment funding or the national housing strategy for additional dollars, as far as I understand from CMHC, will not happen. The funding happens as a result of you building the information, and that comes, through a lot of different things: the size of the building, number of units, composition, demographic you're serving, as well as municipal contribution. So in our financial pro forma that was presented to Haldimand Council, the contributions from the federal government through that co-investment funding that Ms. Van Dyke mentions is as a result and are based on those AAMRs. So I'm not aware, and Heidi might have some other pots of funding, but in terms of our work with the consultants, there is no other, sort of magic pot of money that we'd be able to go access millions of dollars from. We've worked through what's available, and we've worked with CMHC to pull out as much as we possibly can, given the size and demographic of that building. And I'd certainly be willing to have a meeting with CMHC and Heidi to go over those numbers more specifically. But there isn't, outside of the Rapid Housing Initiative or those kind of one-time funding pieces, additional dollars for this project specifically. And it's the same funding model that we'll be bringing to Norfolk County as well.
Thank you. And Councillor Corbett, anything further for your questions? Councillor Huffman and then Councillor Patterson.
Thank you, Chair Taylor. I guess what I picked up on is that there's obviously no one way that's the right way. But this has been kind of a thorn in my side from the beginning of being on this committee, is that I feel like there's two entities who could work together a little bit better. Heidi mentioned about deferring, and I would like to see a more cohesive report where there's a meet in the middle and we're getting one succinct report that takes into consideration everything. I don't feel that with the importance of this affordable housing issue is that we need to be battling back and forth with this, and I would like to see one cohesive report amongst the two groups. Thank you.
Would anyone from staff like to respond?
Mr. Chair, certainly as I said in the report, I'm prepared to go back and do more research. Again, I just advise that these rent levels would apply to all developers. Specifically today, we're talking about the Housing Corporation developments, but they would apply across our service manager area to all new affordable housing developers.
Anything?
Thank you, Mr. Chairman. I would absolutely love to sit down, and I didn't have the opportunity to be a part of the staff report. It was indicated to me that it's a staff community-wide project, so that's why I had to go through the deputation process. But throughout my focus of joining HNHC was to collaborate. I come from Hamilton, where affordable housing development is much different, and it's so my goal has always been to collaborate, and Heidi and I have worked together on the regeneration and asset management strategy. We're not seeing eye to eye, and I respect Heidi's perspective, but I certainly believe it shouldn't be an all or nothing. And really that's what we have here today, and that's why I'm advocating on behalf of the Housing Corporation, because there's a lot of momentum that's been made. Our board has worked extremely hard with community partners as well as both councils, and I believe that there's an opportunity here, and I think that it's important for the Housing Corporation to be part of, as Councillor Huffman said, the process, so that it's synergized.
Thank you, Councillor Huffman. I think I froze out here for a sec. Everyone hear me? Okay, Councillor Huffman, anything further, or on to Councillor Patterson?
Sorry, I hit the wrong button. I got rid of my video. No, nothing. I just want to reiterate that I'm very much in favor of a collaborative approach to this.
Okay. And thank you for that. And on to Councillor Patterson.
Thanks, Chair Taylor. Can everybody hear me? I'm confused with technology. Okay, awesome. I guess I'm a little confused, or I guess not enlightened like the rest of you. I look at Matt and I look at Heidi, and they're the experts when it comes to housing. We're kind of like the layman as far as our opinions on what take you. I guess I have a little confusion, because when I look at the report from staff, when I look at page 5, about 3/4 of the way down, there's an alternative that if council should decide, staff will take it back to the ministry and bring back different AMR numbers. So to me, are we saying that we have a problem with the numbers that the consultant that was hired through Matt or whoever it was that hired, that these aren't actual or real life kind of figures? And the reason I mention that is I appreciate what Heidi is saying, that I definitely do. I agree there. I don't want to push segments of the community out of affordable housing. I don't think that's the purpose that we're taking the time this morning to discuss this. But I also want to use realistic numbers, and the numbers that we have been using as far as $600 to $700 for a one-bedroom apartment in this area is it's so far from reality. It's unbelievable. So I guess my first question is, do we have an issue with the numbers that we see projected through the report, and that's why we wish to have a follow-up? Or if we do accept them as being verbatim, then I think I would probably defer to Matt and would agree with his opinion. I totally agree with Councillor Huffman. Like, we should all be on the same page of this together. And if we have to defer to get a consensus, that's great. But I mean, from what I'm reading, and in fairness, I didn't read it until yesterday. I was away for the weekend, but I find it slightly confusing. I think that both parties should be on the same page, and we're on typically opposite ends of the spectrum right now. So I'm not sure what to recommend as far as if we defer it. And I guess if the answer is we defer it, why are we deferring it? Is it to challenge the numbers that we already have? Is it to do more homework? I'll leave it for both Heidi and Matt to maybe come back with a response. But sitting here, I'm not happy with what's being presented, and we're too far apart on a lot of different issues.
Okay, Heidi?
Thanks, Mr. Chair, and through you to Councillor Patterson and to the committee. Certainly, it is not my intention to be conflictual. As Matt has said, he and I have done a lot of work together on the regeneration study, on the strategic asset management plan, and on other projects throughout COVID and before, in order to support the tenants at HNHC and to support the HNHC as in their strategic plan and in their regeneration goals. I don't think conflict. I think it might appear as a conflict. I don't think it's a conflict. It's a difference of perspective. So the Housing Corporation is, I don't want to speak for Matt, but you know, Matt's doing a great job of explaining to you why the AAMRs are important for their regeneration projects. I have to look at this from the whole spectrum, continuum of housing and homelessness, and think about all of the potentials that could happen and present those to you. And so if that appears like a conflict, my apologies for that, because that is not the intention. We're coming at this from different perspectives. Councillor Mr. Chair, through you to Councillor, answer the question. As I've indicated in the report, I have no reason to believe that the rents that were studied as part of the study are inaccurate. They're included. The AAMR study is attached to this staff report. You can see the listings that were available when the consultants did the study. I have no reason to believe they are inaccurate. My concern is that if we use what is actually going on in the market to calculate the 80%, that is not truly affordable for some members of our community. And that is concerning to me. And perhaps my concerns are unfounded, but that is concerning to me.
Thank you, Heidi. And Matt, you have your hand raised.
Yes, thank you, Mr. Chairman. Can you hear me? Okay, thank you. And you're absolutely right. So, you know, we had to ground our strategy in evidence and data. So when we created the regeneration plan, it didn't come out of left field. We looked at what every other municipality across this province was doing. We looked at a whole bunch of different other things, and we looked closely at the service managers' housing and homelessness data. So we don't have a crystal ball, and we don't know exactly what housing is going to look like in 5 years, but we had to develop a long-term strategy that would, you know, support with multi-year budgeting, sustainability on the project side. And I acknowledge that we cannot help everybody in the community. But what I can say is when Heidi talks about the continuum and the entire system, there is already a heavy subsidy put in place for the most vulnerable population, and that is the 825 units of RGI. What we're talking about is not impacting that, but adding to additional affordability for other people, like those couples who are working, you know, like coupled seniors, like students, for instance, at Fanshawe College. We're not trying to say it's one or the other. What we're acknowledging is that there is already a robust system, as far as I'm concerned, to support the very vulnerable and marginalized. And we see the development of the Dogwood Suites as an example of that was just recently funded. What we're advocating for is additional doors to be opened. And really that's what the AAMR does. It does not affect an RGI. So what we're humbly asking of this committee and council is to, and this is in accordance with the joint shareholder agreement that council has enacted HNHC to pursue these types of opportunities, is that we look at other affordability issues in the community, not just RGI, not just the lowest income earners and the most vulnerable people. I recognize I was a mental health and addiction worker for years. There is a support needed for these folks. And I think based on council's commitment to that with Hamilton Hall and Dogwood Suites, that has happened. Again, what we're asking for is some focus on some other areas of affordability.
All right, thank you. And I have a question myself. If anyone has a question to ask, I will wait to ask. But if I may proceed, so when other communities have increased their AAMRs, what actually happened to the folks that you're considering through those other perspectives? Because I'm sure this isn't a unique situation. I'm sure it's happened elsewhere. So we should have some of that data kicking around. Like what happened to those exceptionally vulnerable? Have we had time to look into that?
Mr. Chair, I don't.
Oh, you cut out just a little bit on my end there.
Oh, sorry, Mr. Chair, that's not data analysis that I've done.
Do we think that data might be out there? If we could maybe have a memo attached to this, if it's when it's coming to the Board of Health with some of those considerations and some of that historical data. So I don't think we should put this on pause getting to the Board of Health, but I certainly do think there are some questions that have come up that we need answers to, if that's a possibility, or if you might need an extra cycle for it, or what have you. Because I do thoroughly want those questions answered and some of that information from those alternate perspectives coming forward, but I don't think we should be putting a hold on this.
Mr. Chair, certainly I can do that research and include an information memo with this report when it goes to council and committee.
Thank you so much. And Matt, your hand's still up. Is there something else there, or is that? Nope, it's not down. Councillor Corbett? You are on mute, sir.
I'm sorry. If we're taking a look at doing some research, how long is this going to take us? We do have a proposal before us in Haldeman County that has been approved by our council, and we're looking at going forward with it. So this keeps dragging on, and I understand you want the answers, but when can we get them?
So, Mr. Chair, through you to Councillor Corbett, if the members of Haldeman are comfortable with the level of information that they have on the report today to make a decision, I would have the information memo as a companion to the report when it goes to Norfolk Council and Committee on October 12th.
I think we're getting a thumbs up from Councillor Corbett there. I think that's a good way to go. So going forward here, are we still looking to accept his information and change that when it goes to Board of Health, or would the board prefer another motion? I'll pass that off. Or the committee, sorry, prefer another motion coming out of this report. Councillor Van Passen?
Yeah, thank you, Mr. Chairman. I will go back to what I said early on with the deputation. If there's a way that we can create more affordable housing, and I use that word not as, government subsidized affordable housing, but affordable built by developers, that in theory will bring down that average rental rate over time. And, you know, there's two ways to get to the same thing. Either you got to raise the amount of money you give people, or you lower the rent in the first place and they don't need as much money. So rather than just receive this report as information, can we also add that, I don't even know what the right wording would be, but, you know, have staff bring some more detail on how best to implement this change rather than just receiving it as information, or recommend to the Board of Health that, you know, this is the direction this committee wants to go, and staff could do some bit more homework on how best to implement it. And, you know, Heidi's already said she will bring a memo explaining what happened in other communities and things like that. But I think we need at least something more than just receiving it as information. So maybe I could ask Councillor Corbett is vastly more experienced than myself on the wording of the motions to get where we want to be. So maybe I could ask the other members for some advice on that.
Councillor Corbett.
Thank you very much, and I understand your discussion on economics, which I agree on. You have to make it affordable for everything. I would take the alternate direction that's offered in the report, direct staff to undertake investigation with the ministry and surrounding municipalities to bring forth true reflection of actual market rent. And we can include that staff get together with Matt to come up with some understandable report for members and trying to see if we can go forward with. As I said, hanging in the abeyance is that project that we're ready for in Dunville. But it's in the report. It said direction to staff. Bring back a report in terms of market value rent and probably what it involves. I know Heidi touched on it, but we want to get a more accurate reflection of where we are through the ministry. If that wording, which would include the consultation between both parties, and I'd be happy with that, putting that forward.
If I may, sir, are you looking for an entirely new report at this point? Because I think we will miss your October 12th deadline that you want there if we're bringing an entirely new report.
Are you gonna? I don't think you're going to accomplish it by October 12th.
Okay. Heidi?
So my suggestion would be that if committee wants to go in that direction, that this report be deferred. And then I have heard the direction of the additional information that you want, including a consultation with the Housing Corporation. And I actually might suggest with other affordable housing developers who are currently in our community, such as Indwell.
Any time limit on that, if I may? I don't want to see it drag on till next year.
Let me just look at our reporting deadlines. So, Mr. Chair, through you to committee, the report deadline for October is September 30th. I can tell you that I will not be able to get all of this done by then. The report deadline for the November meeting is October 28th. I would suggest that would be the earliest one. So either November or December, but you have my commitment, I would do my best for November.
And is that acceptable with the committee? Okay, so I'm looking for a seconder on Councillor Corbett's motion there for a deferral. Councillor Huffman. Chris, I guess there's no discussion on a deferral. Is it debating the deferral or is it a clarity?
Clarity. I don't believe that's a deferral. That is a referral back to staff. They are two different things.
Wonderful.
And because we want some more detail, we're just not throwing it away, deferring it to dog in time. We want to refer it back to staff for more detail. So I'll ask Councillor Corbett if he would consider that change in his motion there.
Like, we got a thumbs up. Referring back to staff to come back for November. All those in favor? That is carried. Thank you, everybody, for that. And on to the next one. We just pull the agenda up here. Who have we got? This is the adoption of the minutes. So any errors or omissions from previous minutes? Not seeing any. With that, could I have a mover to accept the minutes? Councillor Corbett and a seconder. Councillor Huffman, all those in favor? Thank you, that's carried. And Stu, I'm not sure if you're jumping in on these. You're the only one that I haven't got on my screen yet, even though you're pinned. So if you have anything to say, just speak up or throw the pin, throw the hand up. That's all as well. Moving on, we have an update on reports from July 19th, 2021 meeting.
The vector-borne disease report was approved as presented.
Okay, wonderful. Anything further to add? Okay, so on to staff reports. CAO 2162, who's got that? Kevin, I think that'd be you, just popping on there like that, so fire away.
Thank you, Chair Taylor. Through you to committee, the report before you provides a backgrounder about a proposed user fee for what Clerk's Department at Norfolk here affectionately describes as dog bite FOIs. But this is not just limited to dog bite FOI requests. It's just the only ones we received. It could be any type of animal bite. So why is this report before you? It's because Haldeman Norfolk Health Unit is a health information custodian, and as required, you need to be a health information custodian in order to process a personal health information request under PHIPAA or the Protection Act. And we are the Clerk's Department is the consolidated service provider for access to information services for the health unit, which serves both Norfolk and Haldeman residents when the records resides with the health unit. I'm happy to answer any questions. The report is before you and it is to be received as information. Thank you.
Any questions, or I'm looking for a mover of staff recommendation. Thank you. I see no questions. Could I have a mover for the recommendation, please? Councillor Van Passen, seconder. Councillor Corbett, thank you. All those in favor? All right, carried. Thank you, Kevin. That was a good one.
Thank you so much.
And moving on to public health COVID-19 update. And I believe, Heidi, earlier you said that you would be providing us with that update.
Yes, thank you, Mr. Chair. Through you to members of committee, as of today, since the beginning of the COVID-19 pandemic, we have had a total of 2,910 cases of COVID-19 in Haldeman and Norfolk. We currently have 26 active cases, which is an increase of 5 cases over the weekend. We're currently managing 2 outbreaks, one related to school transportation and one related to a workplace. We were managing an outbreak at a retirement home, and that outbreak has been declared over. In terms of vaccinations, to finish up on cases, we are seeing increased numbers of cases in Haldeman and Norfolk. The average is going up to about 5 or 6 new cases a day. The team is managing to get through those cases each day, but we are monitoring for workload and whether or not we need to move into a different level of surge capacity where there would be more staff pulled from regular duties to increase the complement of people working on case and contact management. In terms of vaccinations, to date, as of today, we have at the health unit administered 138,770 doses of COVID-19 vaccine. And we have 62,259 Haldeman Norfolk residents who have completed a 2-dose series of vaccine. Our vaccination rates, and we're now reporting for all eligible individuals, which is age 12 and up. So we have 83.1% of the population who has received 1 dose of vaccine and 77.4% who have received 2 doses of vaccine. Right now, we have demobilized our 2 mass immunization clinics, the one that was in the Cayuga Arena and the one that was in the Delhi Arena. The clinic at the Victoria Community Center, Norfolk General Hospital continue to operate. We're doing pop-up clinics still in partnership with the fire services in both counties, and we are very, very appreciative of those partnerships. In the next week, we're going to be starting to offer vaccinations at our Health and Social Services office in Dunnville. And we are accepting walk-ins at all of our clinics now. So no appointments necessary. We're seeing increased walk-ins and increased numbers of first doses. So that is all very good news. What we are looking at in terms of up and coming are provincial direction related to approvals for vaccinations for children ages 5 to 11. Vaccines have not been approved yet, but we are waiting for further direction and approval on that. We have been administering 3rd doses boosters in the long-term care homes and high-risk retirement homes, meaning those retirement homes that are physically care home, as well as for those individuals who have been referred by a medical practitioner because they are severely immunocompromised. We are waiting to see what the provincial direction will be related to 3rd dose boosters for a wider population. And with that, Mr. Chair, I'd be happy to answer any questions.
Thank you, Heidi. First up, I've got Councillor Corbett, followed by Councillor Huffman.
Thank you very much. And I appreciate that the EMS are reaching out now that they're doing home visits and providing it. I'm very thankful and good to see those additional venues that are coming forward. I hope that gets out on the information as well. Now, we had the onerous distinction of being the lowest vaccinated in Ontario. I understand we picked up some additional vaccinations due to some error in posting to the right area. Where do we stand now in terms of those who are vaccinated in the province? Do we still have that onerous distinction? And then following that, I do have a question on giant hogweed, which I'll ask when you're finished with this.
Thank you, Mr. Chair. Through you to Councillor Corbett. I did not look at the ranking of communities today before I joined, so I can't confirm whether or not we are the lowest.
Heidi, for a second.
Sorry, go ahead, Dr. Sass.
Yeah. Through the chair to Councillor Corbett, I maybe have a bit of a more competitive streak than Ms. Van Dyke, so I did look it up, and we've gone from being at the bottom to 5th from the bottom. So
wonderful.
Still not in the top 10 by any means.
That's terrific. Thank you, Dr. Strauss. So that's great news. We did do the cleanup. The cleanup has happened related to the postal codes. So that definitely contributed positively to our vaccination rates, along with our increased numbers of doses that are coming in through walk-ins at clinics.
Thank you. And Councillor Corbett, thank you for holding your Hogweed question until the COVID-19 stuff's out of the way, so I will move to Councillor Huffman.
Thank you, Chair Taylor. Through you to Heidi and Dr. Strauss. First off, what is the uptake at the vaccine clinics at the local high schools? How productive are they?
Thank you, Mr. Chair. Through you to Councillor Huffman. I was on our vaccine task force call this morning, and Norfolk EMS Chief Sarah Page reported that we're getting about 50 people at each of the schools. Okay. So honestly, not as high as we would like, but 50 people is 50 people more than we had before. So we're going to continue to operate them.
Actually, I'm impressed with that number. I was thinking that it would be lower, so I'm quite pleased with that. And like you said, 50 people is 50 people, so that puts us one more step in the right direction. Now, this is more of a collaborative question, but I'm going to refer back to when Dr. Strauss addressed council last week, and now make sure that I've got the figures correctly. I don't have them in front of me, so this is from memory. I believe it was stated that our cohort of 50 to 60-year-olds is the lowest vaccinated population within Haldeman and Norfolk. Or is that incorrect, Ms. Dr.
Yeah, so not exactly. So in most through you, through the chair, Chair Taylor to Councillor Huffman, I'll get used to it soon, I'm sure. In most jurisdictions, this is per my understanding from Dr. Bishop Williams, the rates in young folks are lowest. The youngest folks tend to have the lowest vaccination rates throughout the province, and that goes up over age. In Haldeman and Norfolk, there's kind of a divot in the 40 to 60-year-olds, and then over 60 continues on that trend. So something like 90% of people over 85 are vaccinated. So it's that divot that's very interesting to me, because that is a divot in vulnerable people. And as I mentioned at the council meeting, I myself had taken somebody to the ICU who was 35 and unvaccinated the weekend before I came to Norfolk.
Okay. I was just wondering, as a group in our COVID response, what we can do to reach out to that age group. I know that when you spoke in front of council, there was probably a lot of other stuff circling around, and some of the really important stuff maybe got missed. And I didn't see much in terms of the reporting in the newspapers that talked about that important number and addressing that population. So just looking, and you can chime in, Heidi, like, do we have any strategies in place to try and get this group? Do we have some outreach to, large workplaces that have a large number of, in fact, I can tell you there's a large workplace in the county where there are a large number of unvaccinated individuals who would be in that group. So just looking at, outreach to employers, what do we have on the plan?
So I don't have. Maybe Heidi has a more thought out answer. I would say this is something I identified a week ago, and I've been brainstorming with the team ways to reach folks. We've talked about a town hall. I don't think that's going to happen. For myself, I have been engaging. I'm still introducing myself to some community partners. So Dr. Nasatharai has very kindly sent introductory emails. So I'm calling family doctors, religious leaders, this sorts of thing. And I suppose, kind of going on, it's a bit of a cliche to say a listening tour, but a bit of a fact-finding mission, trying to have as many conversations as I can with community partners and figure out what the strategy will be. So I don't have anything actionable that I can say at this time, but it remains my chief priority to come up with an action item. The other thing that I've been doing, and this is more color commentary, is the vaccine team has a hotline where they sometimes get voicemails from folks who are vaccine hesitant, and I have been finding it very fruitful to myself answer some of these calls and just see where people are at. Not that I necessarily have been achieving a high vaccine conversion rate on those calls, but I think that's been a good way to get information out there, but it's also been very fruitful for me trying to understand where folks are at, so we can tailor some action items going forward.
Okay, that's important. And I think that, yeah, what we need to do is we've got a group that, you know, for whatever reason, they're vaccine hesitant, and we need to find that medium that works for them and how to best address it. Just wondering if we had any feedback from, and maybe for our next meeting, if we can get some feedback from our community and recreation staff as to how things are going with people having to show proof of vaccination and things like that at arenas and community halls, etc. Not that our community halls are really open, but just kind of grouping all of those in. I know that I received several emails and things like that over the course of the weekend, and just wanted, and it's quite interesting. We've got people who were upset that it took so long to show information, and then I have some who are not so keen on showing the information. But just wondering how our staff is coping with it.
So, Mr. Chair, through you to Councillor Huffman, certainly that is something that I can reach out to Parks and Recreation staff in both counties and brings some information back. Also, if council or counseling committee in both counties meets prior to our next advisory committee, certainly that could be a question that you could ask so that you could get the response earlier. But yeah, I'm happy to check in with our colleagues in Parks and Rec and see how that's going. I have been a part of conversations with Norfolk staff on the planning side for that, and I know that our colleagues in Parks and Rec have been working really hard to get that up and running and make it as smooth as possible for community members who are using the facilities.
Okay, thank you, Heidi. I will make a point of asking that at our next probably CIC meeting and get some feedback, because well, we're all in this together, so just want to make sure that everybody's got the support that they need. So thank you very much.
Certainly, and I'll let our colleagues in Parks and Rec know that they can expect a question so they can have the information available.
Thank you. And Councillor Patterson, before I go to you, Shamir, I did see your hand pop up at one point. Was what you were going to be provided? Is what you were going to provide? Had it been provided, or was that a mistaken click?
Thank you, Chair. I just wanted to add some context. I do know Councillor Huffman was was asking about what each cohort had the least. So I just wanted to provide it is the cohort of the 12 to 17. But I know my colleagues, Dr. Matt and Heidi, have already mentioned the strategies that are being considered to try and increase this.
Thank you. Councillor Patterson?
Thanks, Chair Taylor. To Heidi or maybe Dr. Matt, I'm not sure. Just as a rumor mill question, I got a couple calls over the weekend. Since the certification came into effect last week, have you heard any rumors about folks falsifying their certificates to get into establishments? Or is that...
I think I'm the last person anyone would disclose that to. So no, I have not heard the rumors myself, but I presume I'll be the last to know, Councillor, through the chair to the councillor.
Mr. Chair, through you to Councillor Patterson, I will just add that the staff on our vaccine team here, who so if someone has been vaccinated out of the province or out of the country, they can call us, have their record inputted into the Ontario system, so that they can get an Ontario record, so that when the QR code comes, they can get an Ontario passport. Our staff have been very diligent in checking records for any irregularities, and I will note to committee, and because this is a public meeting, that the direction from the province is that if there is reason to believe that documents are fraudulent, the police are supposed to be notified for investigation.
Thank you. Anything further from committee? Heidi, Dr. Strauss, anything further? Okay. Councillor Corbett, Hogweed, I believe it was.
Thank you very much. And with regard to losing our mantra of having the least amount vaccinated, I think we should do a little bit of our blowing of the horn for ourselves and letting people know about what position are in. They're very concerned, and it's been subject to social media, which isn't kind, as our good doctor knows. I would like to ask with regard to giant hogweed. It's prevalent in our area. We had a presentation at the GRCA with regard to how it is spread, and there's a group involved in trying to eradicate it. I'm wondering if the doctor could comment on giant hogweed as it appears in our community. I've been in a situation where I had a great big rash on my arm, not knowing what it was after trying to fool around with this invasive or evasive, whatever you call species. And I'll take that answer. Thank you.
Thank you, Mr. Chair. Through you to Councillor Corbett. Dr. Strauss has actually had to log off because he had another meeting at 11. I'm not sure if Chimere, you're able to speak to that. Otherwise, what we can do is take this back to our environmental health team and come back with a response for the committee, which we can send out by email.
That's acceptable for me.
Could we have it as email and also part of an open package if there's a member of the public that would like access to that as well?
Yes, certainly, Mr. Chair. What we can do is send out the response by email so that committee has it, and then we'll include the information memo in our next committee agenda package.
Thank you. So moving on here, we do have two pieces of communication. Would anyone like to speak to them? If not, I would like someone to move them.
So, Mr. Chair, if I could just quickly note that the communication from Toronto Public Health, that was a question that's being provided in response to a question that our former MOH, Dr. Hukowich, had been asked at his last Board of Health meeting. And so he asked me to share this information in response.
Wonderful, thank you. On to the committee there. Anyone wish to speak further to any, or if I could have a mover to accept both? Councillor Corbett, Councillor Huffman, all those in favor? All right, carried. And moving on here to other business. Has anyone got anything they'd like to add? Okay, I don't think we've got anything for close. Oh, Councillor Huffman.
Sorry, it was one of those thoughts that came to me after talking earlier about the cohort, and I do understand that 12 to 17-year-old is our lowest vaccinated, but through my simplified deduction, when we're looking at that 40 to 60-year-old age bracket, they are more than likely the parents of those 12 to 17-year-olds. So I still think that's the group that we need to really be focusing on, and that seemed to be the age group of the people that I received the correspondence from this weekend that were, not in favor and that type of thing. So because we know that more than likely, I know that the children don't need to have consent, but parental approval goes a long way for things like this. So I would still like to see us focusing on that age group. So anyways, that was my big aha moment.
Thank you, Councillor.
For a Monday morning. Woo!
There you go. I do actually have one question I forgot to ask. Oh, Heidi, if you...
Mr. Chair, through you to Councillor Huffman, I was just going to say that I think that is a very accurate observation and one that we have talked about among the team as well. And to answer the previous question about strategies, we have been doing workplace clinics in some larger workplaces in the counties. The province also has a mobile clinic that is called the Go Vax Bus. and the GoVax bus is going to be at the Caledonia Fair and at the Norfolk County Fair. And it's also going to be doing a tour through southwestern Ontario. And so we are going to have a couple of stops on that tour in the later afternoon and evening to hopefully make it more accessible for people who are working during regular business hours.
Thank you, Heidi. I do have a question. I know there was a lag when 12 to 17-year-olds were approved by the individual vaccine companies' internal structures. There was a lag between it making it through our federal and provincial structures to actually get shots in that age group. I believe that some of them have their 5 to 11 trials done, and I'm just wondering if we anticipate a timeline on when we can get those shots into some kids' arms, or is that waiting on the province?
So, Mr. Chair, we don't have approval to use COVID-19 vaccine for 5 to 11 yet. So I know that there have been trials, but it hasn't gone through the federal approval process yet. Once the approvals are done, then we get direction to move forward. In terms of a timeline, I don't have a clear timeline on that, but I believe that it's a priority for the higher levels of government.
One would think. So thank you for that. I do appreciate that. And if there's nothing further from anyone, last call, looking for a mover for adjournment. Councillor Patterson, seconded by Councillor Huffman. All those in favor? Wonderful. Our next meeting is October 25th. And see you guys then.
Thank you very
Good
much,
job, Ryan.
everyone.
Take care.
All right. Have a great day.
Bye.
Bye.
Good night.